Hi, and welcome to another video from the CTAD Clinic. My name's Dr. Mike Lloyd and I'm the Clinic Director. In this video, I'm just going to do a short series introduction on something that I think is going to be quite important to a lot of people. And that is trying to understand how dissociation and complex trauma might manifest in different ways as presented to health services. One of the things that we know is that many people who end up being diagnosed with a dissociative disorder have already been diagnosed with 1, 2, 3, maybe 4 psychiatric conditions. So the presentation of dissociation can often confuse mental health professionals. This is really quite ordinary that would happen because it is a kind of condition of hiddenness, as we've looked at before. But one of the things that we're really interested in is how people are seen within mental health services in order for the dissociation to maybe be picked up, understood, assessed properly, diagnosed, and then lead to treatment. Because if a person is treated for a condition which kind of sits on top of dissociation and that dissociation is not taken into account, then the likelihood is that the treatment for that other condition is not really going to be all that successful because the dissociation gets in the way. So the way that the symptomology of dissociation occurs really does get in the way of treatment for other different conditions. So as an example for that is someone who might have, say, treatment-resistant depression, could be a psychiatric diagnosis that they've been given, because none of the treatments that are generally used for depression are all that successful. And that may well be because there is underlying complex trauma and depression that is not being taken into account. And if dissociation isn't understood and treated within the context of the overall condition, then things are likely not to work as successfully as they should be. This is very difficult for people because often they then get labelled as treatment resistant, or they get blamed because the treatment should work and then it doesn't. And what the clinician isn't then doing is trying to look for underlying causes as to why that treatment might not be working. For example, there might be dissociation present. So we've got all of that. In addition to that, what we also have is that there are many comorbid conditions associated with complex trauma and dissociation. So comorbid is when you've got two different conditions existing in the same person and they're both diagnosed correctly and they're both manifesting in different symptomology, but they are, taking place at the same time. So what we then see is lots and lots of people in specific services for specific conditions where they are being treated for that quite rightly because they have that condition, but then the dissociation is not being even looked for, assessed, or even understood. And there have been some studies done, including one that I've done myself in the inpatient wards, where people are, have been admitted for various different psychiatric reasons. They are dissociative, and that dissociation has not been screened for, understood, and therefore not treated. So we have all of this stuff taking place, so that a person who is in mental health services with complex trauma and dissociation is highly likely to also be demonstrating a series of other types of conditions or symptoms that might be either misunderstood or diagnosed correctly, but then prioritized in favor of anything to do with screening for dissociation. So there are lots of conditions floating about within the psychiatric sort of setting where dissociation is then just not seen, assessed for, treated, and therefore the person can remain unwell for much longer than should be expected. And we know that many people with dissociative conditions sit in mental health services for many years before dissociation is even recognised or considered as to be a thing. But then when the dissociation actually is seen and understood and treated for, sometimes the other conditions really start reducing just sort of by themselves. So without actually doing anything active to treat those conditions, the symptoms can reduce because the actual underlying root cause of the complex trauma, i.e. childhood trauma, and dissociation is being sorted out as best as possible. So I'm going to look at a number of different conditions. So expect to see some new videos coming out over the next few weeks where we look at these kind of conditions that are really commonly seen. Sometimes they're quite physical, sometimes they're quite psychiatric, psychological. It doesn't really matter. We're going to look at some of the common ones that I see within our clinic setting here in CTAD, where people have these conditions and they are sort of seen over and over again. They're like the most common different to dissociation conditions that people are presenting with. So we'll do a little bit of a background check on all of those, have a bit of an understanding as to where they come from, why they might be present, what can be done to try and help, and what the solutions for this sort of little difficulty might well be. So I hope you enjoy this series. I hope this is something that's interesting. As always, please do leave your comments and thoughts about this in the section below. And obviously please do subscribe to the channel, so that means that you'll get notifications for the other videos as they start dropping. So thanks very much for listening to this one. I hope you enjoy the series. And as always, you know, as with these videos are sort of coming out and we're sort of talking through all these kind of things, please do take great care.